it has enabled us to, or for patients to book into an appointment themselves. And we've had lots of appointments that have been booked that way. And actually that means that, you know, if we've got over 1,000 appointments that have been booked by patients, that means that's 1,000 people we don't need to contact manually. So Bridgeview Medical is a merger of 4 practices in Bedminster and Southville in Bristol. We currently have, I suppose, about 38,500 patients, all told. Prior to the pandemic, patients would come in and they would book at the desk, or they would phone in. Then we would have, you know, we'd give lists to our care coordinators or receptionists, as they were then, kind of thing, and we would ask them to call them through. And that was, so it took an awful lot of resources away from the, you know, the basic functionality of our kind of care coordinators kind of thing. So it was very, very time consuming. It was on an individual basis. The other thing that we would do on occasions is we would send out letters. I think cost of resource. So now, especially now, I think now we're post-pandemic. So obviously the demand on our services has increased, you know, by a huge amount. I mean, I think all of the GP practices are struggling, and that's on as a, you know, national kind of thing, not just us. The demand for our appointments is one thing. The demand, you know, on our staff, telephone lines, you know, everything has just gone through the roof. Obviously, money is tighter. We're being asked to do more for less money. So that means that we don't have those physical resources available. You know, we don't have the funds to support that activity either. So everything becomes, you know, you have to do more for less. But actually the physical act of, you know, phoning a list of patients, well, we just can't do that anymore. And we needed something that actually we wanted to be really proactive, because it is all about money. If we can get more, you know, patients into our service than, you know, them going to a pharmacy. So that's, you know, that's what we're looking for. But we needed something that we could give to patients and say, here are the appointments, book. Yes, because what we would be doing now is so I'm still going through the process. So for all our flu vaccines or invitations kind of thing, we have to invite patients a minimum of twice. And then actually, once you've invited them twice, you're then on that kind of, you know, you need to understand why haven't they booked, you know, what's stopping them being booked. And actually finding out, well, they actually, as much as it says they've got a mobile number, they haven't got a mobile number. So it would now give me the time with, you know, within the flu season to then explore those other options of contacting patients a little bit better. I just can't think off the top of my head now. Blood tests and other appointments where it doesn't need navigation. But there are other things that we can book in. So, you know, there are times that, you know, potentially even dressings, we could look at that going forward. But things where it's very much, this is the appointment and this is the time frame for this appointment. And there are other key kind of treatments. So I'm just kind of thinking where patients have to have a type of appointment on a regular basis. So that where they're diary noted, so they have to have an injection every 3 months apart, for example. So those kind of things, you know, that would be a great way of doing that, because you can just then click and say, well, this patient needs to be booked in for this. Yeah. You know, and it allows the patient the freedom to book an appointment which fits them, and they have that choice. But it also would then allow them to kind of, well, want to book it, but actually it would free up our resources, so our telephone lines. So that those patients who need to book a same day appointment and they need, you know, a home visit or anything like that, that's what our telephones are for. Or if they need to book a routine appointment, for example, that's what that is. And that gives the patient a little bit more autonomy over their own healthcare. And that's really, you know, they become, you know, a manager in their own, you know, in their own kind of provision kind of thing. So that, you know, that's what we're looking for, I suppose, longer term from these things. This one key thing is that it has enabled us to, or for patients to book into an appointment themselves. And we've had lots of appointments that have been booked that way. And actually that means that, you know, if we've got over 1,000 appointments that have been booked by patients, that means that's 1,000 people we don't need to contact manually. That's the thing. And what we're really looking for is, we're looking for, you know, the ability to book, you know, at least 75% of our patients in this way, you know, so that they can book in themselves, because it just makes it far easier for them and for us, kind of thing. So yeah. So the reception teams are rarely affected. So that's a big bonus, because in flu season, you could guarantee that you would spend at least half the day, you know, each receptionist would at least have, you know, a half day's worth of phone calls or interactions with the patient about flu bookings, or that they would be phoning patients. So I think, you know, it has saved us a massive amount of work. That doesn't mean that it's still not going on, but definitely that, you know, it has saved us. I think it's the resources more than anything that it's saved us on. There's only a few of us now working on this system, so we've got a couple of volunteers that come in and help the booking, and then permanently, I suppose, there's myself, you know, as an operations manager, and then you've got I've got an administrator. And the two of us primarily are the ones involved in booking all of these appointments. So if you think of that, rather than, there's still a team around us that, you know, we're not the only ones involved in the whole sort of like service kind of thing. But in the invitation process and the booking process, that's really, you know, we're down to kind of, you know, 3 to 4 people maybe a week dealing with this, as opposed to everybody, you know, all of the care coordinators being impacted by this. So yeah, huge impact, you know, reduction in our resources for this. So yeah, definitely it's made a difference.